I'm Alicia with Chariot Solutions, and I'm here to introduce Michael Becker to present Open Source on Steroids, a near light speed global release and scale of a pandemic modeling solution. All right, Michael, take it away.
All right. Hi, everyone. Actually, I don't have the window open showing me the attendees, so maybe I'm not sure if you can tell how many people there are, but I'd love to hear how we're doing before we get started here.
Yeah, we've got 17 people with people trickling in as we go.
Okay, great. Thank you. So hi, everyone. My name is Michael Becker. I'm a senior data scientist at Penn Medicine. And you can find me on Twitter at Beckerfuffle. I don't tweet too much these days, but go ahead and follow me, and you might be pleasantly surprised. Maybe I'll start tweeting again soon. So as I said, I work at Penn Medicine. For those of you who aren't from the area, Penn Medicine is a healthcare system in the Philadelphia region. We also have branches in New Jersey and other parts of Pennsylvania. And our total economic impact is $15 billion. We have around 70,000 employees. And so just to give you an idea of the geography, you can see the orange square there is Philadelphia, and the blue and red dots are the different facilities that are part of Penn Medicine. And so prior to the pandemic, I spent most of my time working on predictive models. Right prior to the work that I'm describing today, which is around pandemic modeling, I was working on a predictive model for identifying stroke patients using radiology notes. And at the same time, I was also working on something similar using clinical notes for identifying sepsis patients. And so I'm sure everyone on the call today remembers what it was like at the beginning of the pandemic. And so this was 8 days before we started our work. There was a headline in the Atlantic: the official coronavirus numbers are wrong, and everyone knows it. And I'm sure everyone's saw these headlines. I'm sure 2 days later, Governor Wolf signed an emergency declaration after 2 confirmed coronavirus cases. And then a couple of days later, the Department of Health announced that there was a positive case in Montgomery County, and that this was a patient at Penn Medicine in critical condition. And 1 day before we started working on our model, the president of University of Pennsylvania announced that they were shutting down University of Pennsylvania for the remainder of the semester. And so the day that we started working on this project, my boss had just gotten back from vacation in Michigan, and he sent us this message saying that he was in meetings all day talking about COVID-19, and that it sounded like they were going to need our help with predicting the surge and with the response. And so at this point, I'm sure that most of you are familiar with this concept of flattening the curve. And so the red curve here you can see is what the pandemic may look like without some measures put in place. And then and it would go, and you can see there's a line here in this graph showing that without intervention, the health system may go over capacity. And then this concept of flattening the curve, we apply some interventions. They call these NPIs, non-pharmaceutical interventions. and that may slow the spread of infection. And so it was around this time that a coworker of mine actually found this interesting tool called COVID Sim, which had recently been released. And it was this fun little interactive visualization that you could play around with. You could modify the parameters. You can see there's, on the left-hand side here, there are quite a lot of parameters to tweak in this model. And it was really cool, but also somewhat overwhelming as far as like the number of parameters in the in this visualization. And so, you know, my coworker sent this around, and Asaf, and you can see that the team was pretty excited about it. And so just to kind of give you an idea of what type of model this was, you may have heard of this before, but this is a SIR model. And so SI and R stand for susceptible, infectious, and recovered. And these are, this type of simple pandemic model is called a compartmental model. And the reason it's called that is because patients or people are in one of these three compartments, either susceptible, infectious, or recovered. And then there's some parameters to the model that dictate how people progress from one compartment to the next. So for example, there's this beta parameter that is also called the infection rate or rate of spread. And that's the probability of someone moving from the susceptible compartment to the infectious compartment. And then there's this parameter gamma, which is the recovery rate, which is 1 divided by the duration of the infection. And that determines when in these models, someone moves from the infectious compartment to the recovered compartment. And so when we were initially looking at building our own model or using some existing models, the first thing we observed is that the size of the initially infected population, but like how do we estimate that? So how do we take, it wasn't clear how we would take some of these toy epidemiological models like the simulator that I was just showing you and put them into the local context using what we know at the hospital level. So what we know at the hospital level is things like the number of beds, the size of our region, and the number of COVID patients that we've seen. And so even for the small number of projections the CDC was providing at the time, it was hard to figure out how to translate that into the local context that would apply to our hospital system. So like how many beds would we need? How much PPE would we need? When will it get bad, and how bad will it get? It wasn't obvious. So my coworker, who's a data scientist on my team, Corey Chivers, he that night implemented the sort of like this initial SIR model. And I'm going to walk you through not every line of code, but I'm going to demonstrate to you exactly how simple these models are. So you can see we're importing a single library here, pandas. And here's the main functions for the model itself. Not too many lines of code. And here's the main part of the model being run. So we set some initial conditions, and we pass those parameters into the functions that he wrote, and it produces these curves that you're probably familiar with number of infected, number of recovered patients over time. And then the one sort of important aspect of of the work that Corey did was he added in this additional layer, which allowed us to translate those numbers into projections around how many patients would be hospitalized, how many patients would be in the ICU setting, and how many patients would be ventilated at Penn Medicine facilities. And so this initial version that Corey had implemented was a IPython notebook, or a Jupyter notebook, they call it these days. And so this is, an interactive tool that Corey could use to run various scenarios. And the next day, I'd gotten into work, and I was having trouble focusing on my own work because of what was going on, obviously. And so I asked Corey how he was doing and if he needed help with anything. And he asked me to, if there was any way that I could turn his Jupyter notebook into an interactive tool, which isn't something that we typically do too much, at least on our team. So I did, what any good engineer would do, and I hijacked Code4Philly Slack channel. I had been involved with this opioid data hackathon with Code4Philly that was actually ongoing at the time that we started this work. And so I reached out to the folks there and I asked them, does anyone have any recommendations for interactive visualization tools? And so some of the suggestions that I got from the people at Code4Philly was Booka, Altair, Streamlit, and Viola. And then there was this awesome YouTube video that was shared with me by Michael Chow, who's a bit of a sort of like a prolific, I would say, data educator, or specifically Python data educator. He has, a lot of YouTube videos where he walks through different things. He's maintains several data related libraries. And so he shared this video with me where he compares a bunch of these interactive visualization tools. And just based on watching the video, it was pretty clear to me that Streamlit was going to be at least the quickest to try out. Someone also had shared with me how to easily deploy a Streamlit application to Heroku. So I figured I'd give it a try. And I think probably within half an hour or so, I had a working prototype. But before I finished my work, I decided, I would do what any good engineer did when they're in a crisis, which is I went out and bought some bananas. At that time, at least the supermarkets weren't swamped yet, and there was still toilet paper in the store, I think. So later that day, a couple minutes later, my boss was inquiring as to if someone had started working on this, and since I had already started working on it, I let him know that I was trying to get an interactive version of his notebook working, and that I'd screen share when it was running. You can see this is around 4 o'clock that night. And then I shared it with the team, and my boss asked me if I thought I could get it working over the weekend. And I told him I'm pretty confident I could get it working that night. And so here's just a quick screenshot of, I think, what the first version of our interactive tool looked like. And you can see on the left-hand side here, there's boxes for you to set the different parameters for the model. And then on the right-hand side, we have graphs, the same graphs that you saw in the Jupyter notebook, essentially. And so I tried, around 7 p.m. on, I think it was a Friday. I tried deploying that to Heroku, and of course, immediately started getting errors. Infamous PC load letter. But we discovered that if we reloaded the page, it seemed that the errors went away. So we just added some instructions some temporary instructions to the app to say that if you see any errors, please reload the page, and we were good to go. And of course, before you can release any tool, the most important thing is, what do you call this? What do you call this thing? So we went back and forth with some pretty bad names, and we asked Susan, who's really good at coming up with names for things, what should we call it? And eventually we landed on CHIME, which of course is a completely original and not at all hard to Google acronym. So you can see here, after, we were now one day or almost 2 full days into this process, and we had an interactive tool that we could share within the health system. And then that evening, we got this feedback from our chief of critical care, which was, I haven't mentioned this before as a motivating factor, but I will now. PPE, which is personal protective equipment. Education is unfolding as we speak. The tempo of this vitally important education could be guided by the timing of the anticipated surge. On behalf of many, I'm grateful to you for applying your talents to this right now. It's more valuable than you can imagine. Thank you all, which is probably one of the nicest things I think any of our collaborators has ever said to us. And all this after spending, just a couple hours with Streamlit. And so this was from Corey. He said, we want to give leadership the ability to test out variations on the assumptions, but we also still need to run it for them and give them guidance about plausible outcomes. I don't think that just giving them a link to the tool will be enough to support them. So this is the next day. I think it was Saturday at the time, and so Corey came up with this plan, which was basically we would come up with 4 different scenarios, basically best case, worst case scenarios that allow us to bound the projections within plausible ranges based off of different inputs. Because at the time, it wasn't entirely clear, for example, what is the reproduction rate of the virus in our region. Data was very sparse. There were a few publications out of China and out of Italy at the time, and we were basing most of our estimates off of that, but the numbers were still very uncertain. So this is an example of the first set of reports that went out to the executive team. You can see we had we started off by specifying what were the conditions, what were the assumptions, the inputs to the model essentially, and where we got that information from, the sources we got it from. So you can see there there was an AHA webinar about COVID-19 and some internal estimates from some people at Penn and so on. And then what we provided to them were these projections that showed first in tabular in tabular form what the hospitalizations and ICU or new hospitalizations and new ICU cases would be going forward. So when can we expect things to really pick up? And I'm showing here sort of like the best case, worst case scenarios that we were showing the executive team at the time. So we had this we had this meeting with the executive team and we presented them these projections. And I think this is when at least I personally realized how bad things may get. So there was fear that we'd be over capacity in just a few days. And at least our projections helped assure the executives that at least there was some runway. We had time to plan. And people really struggle with exponential processes. And so it was good to be able to show them it's not going to get really bad right away, but in the future it could get really bad. So we need to start planning. And they, the executives had been talking with other hospitals that were starting to get overwhelmed, and in like Italy and Washington and New York City, for example. And so they were, talking about setting up a tent city. They were calling it on Penn's campus in case they needed overflow beds, and restrict, the possibility that we might in the future need to restrict access to ICU beds by some set of criteria. And so immediately after this meeting, Corey's, it was great to have these meetings with the executive, because he realized that his suspicions around the limited extent to which the clinical and operational decision makers want to actually interact with the tool and do their own interpretation was well-founded. And so he said, this doesn't mean that the tool has no utility. It helps us generate results quickly for various scenarios, and still stands as something we can point them to if they disagree about an assumption, even if they're not going to use it themselves. And my initial reaction after that meeting was, just based on this call, I think this tool's lifetime can be measured in days. And if we're going to share it out, it needs to happen immediately, because I saw how much of a positive impact it was having on our own team. And I knew that there must be other hospitals out there that were struggling with the same kinds of questions and the same lack of information. And so I sent this email out to some a mailing list of tech folks that I'm on, and I said, please don't share this widely, since it will definitely bring down our app running on a free Heroku instance, but we're looking for some reliable, ideally free hosting for our app. And I was just basically soliciting advice, because what was going through my mind was to get this out there to the people who do need access to it, to those hospital administrators, as quickly as possible. We're going to just need to release this publicly. And there's no way that we're going to be able to control who has access to the tool, especially on such a short time frame. So I was anticipating that, the tool might garner a lot of interest, and wasn't sure, what the capacity requirements of this tool was going to be. I'd never deployed a Streamlit app before, so I just was starting to worry. Fortunately, the folks on this mailing list essentially assured me that it would work out okay. And I had talked it over with my boss, and he decided, he put it on his credit card if we needed to scale it up on Heroku. And it was also around this time that I had a fun conversation with my father about how bad things were looking, and he told me, Mike, you're getting obsessed. And I told him, I'm not obsessed, it's my job. And he said, I still think you need to relax a bit. And I told him, tell me that in 2 weeks. So, maybe I was freaking out a little bit at the time, but I feel like in the span of 2 days, I'd gone from feeling like, okay, maybe everything's going to be okay, to this very different scenario. And so on day 2, I think, again, this was a Saturday, on Pi Day 2020, we announced CHIME and posted a blog post about it. And I also had posted something on Twitter, basically asking folks if they had any idea how to get free Heroku credits. This was around the same time I was talking with those tech friends, and Michael Chow reached out to me and he said, "I saw your tweet and remembered that we have a setup with Linode where they provide free resources. So I'll carbon copy you in our DevOps channel." And so I told him, "I think we're okay for now, but I might need your help later." And I also told him, and this is only day 2, that I was feeling pretty burnt out right now. So that's pretty ominous. And so he introduced me to Chris, who would get me set up with Linode. And Chris said, "Want a VM?" So this was, it was really lucky that I had these contacts with these folks in Code for Philly, because they were really able to immediately kind of help out. And then, then day 3 rolled around and we had our first feature request. Someone was asking us, "Can you make it so that one of these inputs can be a float instead of an integer?" They were working in a part of New York City where they had a very small market share, and they wanted to be able to use our tool. So things were really starting to pick up on day 3 here. And my boss sent us this message. He said, "Our analysis shows that the pandemic is going to be with us for a while, and I want to shift into a reporting routine. As long as the tool is useful, will be our highest priority to maintain and improve." So at this point, we were basically dropping all of our other work and working on COVID 24/7. And then on day 4, the folks at Code for Philly, or Chris from Code for Philly, started working on setting us up a Kubernetes cluster for deploying the application so that we could scale it out as demand increased. And so, the obvious benefits of this was it allowed us to, again, scale the application pretty seamlessly. And Code for Philly, fortunately, has a pretty big team of people that are really experienced with DevOps. And so they were really able to jump onto this. They had an existing effort that around setting up a sort of a community cloud, I think is what they called it, which was essentially a plan to set up a Kubernetes cluster that could be used for all sort of civic-hacking projects. And so they sort of fast track that work to get things moving for the CHIME app. And then around the next day, developers had been streaming in, and one of the developers submitted a ticket to add CI/CD, continuous integration and continuous deployment. And this was actually new to me at the time. I was not familiar with GitHub Actions. We actually learned a lot from working on this open source project with the community, and we're making heavy use of these GitHub Actions internally on my team now for both continuous integration, continuous deployment, and continuous deployment. And so, yeah, it was really awesome to see the community just kind of jump in and start working on this stuff. And then on day 5, we had Chris Henderson reached out to offer to try to get support internally from his employer to basically allow people working at Comcast to work on CHIME, to volunteer for CHIME during work hours. And then day 6 rolled around, and Marika, set us up with some user documentation. And so this was really helpful. I have here a screenshot of what the user documentation looked like. And this was all managed also through, I think, Gitbook, which was, again, a tool that I'd never used before. Another huge benefit of working with folks who are familiar with these tools and with the open source community as a whole. And then also on day 6, we started getting feedback from people who were using the app. So this was a note from a chief operations officer at some other health system who said, we're using this to drive staffing, supplies, equipment, and facilities planning, and it's making a huge difference. Just so you know, the work the team did and are doing matters. We will save more lives because our plans will be scoped appropriately. And my boss sent this message to the Code for Philly contributors, letting them know that on behalf of Penn Medicine, he wanted to thank them. And the projected capacity needs are sobering, to say the least, but CHIME's accessibility and clarity have helped steal our leadership's focus in supporting our healthcare team and expanding capacity. I'm on daily calls with our leadership, and there isn't a day that goes by without them thanking the team. They are all aware of Code for Philly's contributions. So we're already only 1 week in at this point, and we're already having a huge impact, not only at Penn, but at other health systems, which is pretty amazing. Also on day 7, Michelle Lee, who I think used to help run Code for Philly, is also a big open source aficionado, offered to start helping us out with project management. And boy, did she really hit the ground running. She spent only a few minutes and he set us up with boards built into GitHub for tracking our project, and she set us up with templates for our GitHub issues and just all kinds of organizational stuff that we really needed a ton of help with. I think probably at this point we had around 20 open source contributors contributing to the project, and things were starting to get pretty hectic. And it was because things were getting pretty hectic. It was also on day 7 that I started reaching out to some of the developers who were most active and asking them if we could delegate some of the project management to them. So I messaged Quinn and a few of the other developers and asked them if they could kind of focus on specific parts of the application and take over managing the tickets for those parts of the application. And a few days later, we actually saw one of the biggest benefits of working on an open source project, which is, I may be butchering the quote here, but there's a famous quote about all bugs are shallow with enough eyes, essentially. And so we were very lucky that several of the contributors actually identified that there was a pretty important bug in the way that we were calculating admissions and census in the model. And so we were able to issue a fix, and it turned out that we had probably been underestimating the peak or the amount of resources required due to this bug. So this was it was really great that if we hadn't open sourced the project, we probably never would have known that we had this bug. So it was great. And then almost about two weeks into the project, we actually started working on a new project, which was around a Bayesian version of CHIME. So we had gotten consistent feedback from the executive team that they wanted to get a better understanding of the amount of uncertainty around our projections. And the team had also been working on implementing more complex models. I won't go into the details here, but they're more complex pandemic models out there, and so we also added some of those additional features to our Bayes CHIME, and you can see the benefit of our updated model was that we were able to provide sort of these bounds, confidence intervals essentially around our projections. And in addition to that, the other big benefit is the models were actually fitting the data that we had. So you can see on the top left graph, there's a red line, which is the actual observed data that we use to fit the model. And then on the right side of that graph, you can see the projections along with the uncertainty around those projections. So, even though we can't necessarily predict the peak, it helped us put bounds on the possible outcomes. And a few days later, was pleasantly surprised to discover that our model had been integrated into Arcgis, which is a pretty big tool used by a lot of people in government along with elsewhere. But the way that they were sort of advocating that CHIME be used in their tool was presumably for public health officials to be able to project where are the future spikes going to be worse or better. So where do they need to send resources essentially? And then around day 22, this article came out in the Washington Post where they talked about how DC was using CHIME for their projections. And luckily for us, a day later, one issue that we had since the very beginning of the project was it was very hard to integrate Google Analytics into Streamlit applications. They may have solved this problem by now, but at the time it was very hard. And so luckily the folks on the project figured out a clever way to inject Google Analytics into the application. And we started getting visibility into our users. And so you can see we had at the time around 55,000 users. And it was great to be able to see that the tool is being used all over the world, primarily in the United States, which is maybe not surprising. And then when you zoom in on the United States, you can see it was being used very heavily in essentially the Washington, D.C. metropolitan area. And so our hypothesis there is that there were a lot of people finding out about the tool because of the news coverage. And so that's where probably a lot of the traffic was coming from. But just to highlight some of the organizations that were using the tool that you can find just by looking at public sources, the state of New Jersey, obviously, District of Columbia, as I said, Ochsner Health has published a paper saying that they were using CHIME, the Ministry of Health in Sri Lanka, Mexico City, the country of Colombia was using it, and it was being used in Australia. And then, of course, there were many journalists who had been using it for various uses. And there was both positive, I would say both positive and negative coverage associated with the use of CHIME. Some journalists were using it to second guess their local public health officials. But that's one of the side effects of working on an open source project. You cede control. You can't really control control the narrative once you release it to the world. And then about a month into the project, we had been internally, some of the researchers at Penn had been working on a paper describing CHIME and its impacts. As you can see here, locally informed simulation to predict hospital capacity needs during the COVID-19 pandemic. And so just to highlight a few of the points from the paper as far as the impacts that Penn saw by using the model. They were able to rush, or they use it as a motivation to rush construction of a new hospital that we had been working on, adding around 100 extra beds of capacity. They canceled elective surgeries and transfers. They set up new ED triage units to deal with increased demand. They started working on PPE and ventilator conservation and acquisition. They worked on expanding the ICU. They set up plans for doubling room capacity, and they reserved hotel rooms for staff. And this was a nice quote from the paper. We anticipate that the epidemic insights gained from CHIME will save many lives by turning vague scenarios of overwhelming clinical demand into actionable estimates of strain, permitting our health system leaders to prepare, react, and respond. And then it was also on day 27 that we had this fun tweet from Code for Philly, basically showing that how much we really broke Code for Philly. So the first peak on the left-hand side around week 5 of the year was actually that opioid data hackathon that I was talking about. And you can see I haven't added up all these numbers here, but I think we had somewhere around 400 new Code for Philly members during this very short one month window working on this project. And then a few days later, there was a paper released, and I found this quote in this paper that I really liked, which was, as with hurricane tracking models, they make varying projections, yet in the face of uncertainty, they provide useful real-time forecasts to prepare for the pandemic, as evidenced by their broad use. And finally, kind of to wrap things up, one of the last big changes that we made to the model, one of our data scientists, Tybin, was working with the Penn LDI Institute to help with planning for PPE needs. And so one of our last changes to the model, a little more than a month and a half into this project, was to add these PPE projections to the tool. Kind of to wrap things up, I'm leaving plenty of time for Q&A here, but to wrap things up, I thought it'd be interesting to kind of discuss how can open source help in future pandemics, because obviously it not only was our project open source, but it really couldn't have existed without the other open source projects that we're using, like Pandas and Streamlit, for example. So I think, at least in my view, just like open source is heavily used in the Martian Ingenuity helicopter, it will continue to be used in future pandemics. But I think, at least for me, my hope is that the federal government will take a much more active role in these modeling efforts, specifically modeling, building modeling tools that can be used in these local contexts, like what we did with CHIME, which is, I think, what was really novel about what we built. I think having those tools kind of ready to go for future pandemics is going to be much more helpful than kind of the open source community putting together this Herculean effort to get things done in a very short period of time. So that's all I had as far as a presentation go. As I said, I want to leave plenty of time for Q&A. So
thank you.
Pass things off.
That was really an adventure, especially those first few days. It seems like it was a big scramble.
Oh, yeah.
So I will be reading questions from Zoom and Slack if you want to ask questions there. And we do have a question. Did you ever go back and compare the predictions to what actually happened, either at some point or maybe as sanity checks throughout the course of the project?
Yeah, we did. I don't have any slides specifically addressing that, but that is a good point. There were several, on several occasions, we went back and looked at our previous projections. One nice thing about having these slides, copying the output of our models into these slide decks for the executive team was that we had a record of the exact projections that we provided. So we were able to kind of go back retrospectively and check our projections against what actually happened. And, you know, they generally did pretty well. I think one of the biggest issues that we identified was that it's very, very hard to predict the peak of a pandemic. And you know, a lot of this has to do with just because you're talking about exponential processes. And if you go beyond, you know, more than a handful of days, your projections are going to be sort of overwhelmed by that exponential process. And there'll just be too much uncertainty. So one of the early lessons that we learned by reviewing our projections and how they performed was that we really needed to set sort of like a short time window of maybe 30 days as the maximum amount of the furthest that we should be projecting out with these tools.
Thank you. For another question, was Penn ever able to collaborate with CDC or other agencies to provide better insights and planning?
Sorry, was Penn able to collaborate with CDC or other agencies?
Mm-hmm.
I mean, we did have conversations, I believe, with many sort of public health agencies. I wouldn't care to like name any in particular, but we did consult with some with some public health agencies, at least early on.
If you were to go back to the beginning, would you use Streamlit again, or are there other options that would work better, or maybe any tool that you would have changed?
Sure. So, you know, I think Streamlit has its pros and cons. The obvious pro and like the reason that we chose it, and I would say, you know, even looking back, I would still choose it for the initial iteration is just the speed of development. It allowed us to get the tool out there in less than 2 days, which is pretty much impossible. Most other tools, at least for someone who doesn't have a lot of experience with these tools, if you have someone on staff that spends all their time building dashboards with some existing technology, I definitely recommend that you use one of those other technologies. I'm trying to remember the name of the other framework that we were planning on using. One of those other frameworks from the slide that I was showing earlier was actually what we decided to switch away from Streamlit while we were working on the project. Maybe like a month or 2 weeks in, we kind of switched gears because there were several features that, yes, it was Dash. Thank you, someone from Code for Philly. Yes. So we decided to switch over to Dash, which allowed us to implement a lot of features that we just simply couldn't implement with Streamlit at the time. But the kind of the trade-off there was there's a lot of added complexity to using Dash. So there's a balance you have to strike there.
In terms of the open source involvement, you had a lot of code coming in, a lot of collaborators, but how was the public access to data on the project?
Sure. So well, of course, we were updating the app on a regular basis with with numbers that were relevant to Penn. There were a few other regions of the country or health systems that were publicly sort of publishing numbers that could be used for as inputs to the model. But definitely, at least at the time, it was pretty hard to get your hands on the types of data that you would need to accurately use the tool. There wasn't much public data available at the time.
As a follow-up, how did that change over the lifetime of the project? Did you see that improve?
I mean, a little bit. It wasn't great. As you can tell, the lifetime of the project was pretty short. I mean, certainly it's still out there and we still get users using the application, but I consider the lifetime of the project to be like really the first month or so, and not much changed in that time period.
Okay, I think that's all the questions I can see in Zoom and Slack. But I'll ask a follow-up of my own. If you could pick one thing that really boosted this project, it's going to be hard to pick one thing, but what comes to mind?
Yeah, I mean, I won't pick one thing, but I will maybe just arbitrarily rank a few, which is, I mean, certainly the civic hacking community, Code for Philly, was a big boost to the project. And also, I would say just the open source projects that we built CHIME off of, like Streamlit and Pandas, and just the Python data open source sort of project community in general.
Yeah, a lot came together at the right time, it seems like. And like you said, Herculean effort to bring all of that together.
Yeah, I think we're really lucky.
And there's another question. What's the plan for spinning this project down?
I'm not sure there really is a plan. I think at this point, we're happy to leave the project up for prosperity. I think from an educational perspective, it's still quite a useful tool, even though you certainly wouldn't want to continue to use it for our current pandemic. It wasn't really built, for example, to predict past a single peak in cases, and at least in the US, we're at like we've just passed peak 3 or 4, I guess. But yeah, I'm not sure. We haven't had a discussion about with the Code for Philly folks about what our plans are for spinning it down. Someone says we got 900 monthly visitors last month. Okay, I guess we have someone from Code for Philly here.
Yep, it's still alive. And it's great to hear that it's still getting usage.
Yeah. I mean, I cringe a little bit because I do know that, since we haven't updated it since almost a year ago, it's certainly not the best model to be using right now, but it's cool to see that people are still playing around with it in some way.
Yep, open source takes on a life of its own once you get it out there.
Exactly, yeah.
Okay, it looks like we are caught up with questions. And if anyone has any other discussion or questions, feel free to hop into the Room B Slack channel. Michael, thank you again for presenting this wonderful adventure. I love presentations that are stories. It really grabbed my attention. So thank you very much.
You're welcome.
And oh yeah, thanks. And for the audience, we do have more talks over the next 2 days. This was a great talk to end on, and I hope everyone has a great afternoon.
All right, thanks.
Thank you.